Cool. Hi, everybody. Thanks, Tony, for that. And thanks for the invitation to give you a brief update on what we're doing with BEHÇET'S patient support. For those of you that don't know me, I'm John, and I've got the privilege of working with Jean, Jackie, and Beck, who many of you will know from the three Centres of Excellence. Well, where do I start? Well, what a difference a year makes. I remember this time last year, we kind of didn't know what COVID was. We were happily attending the AGM in Harrogate. We could meet our friends, our colleagues and patients, put faces to names, and obviously you could buy lots and lots of handmade Christmas cards. Since then, we've had to get our heads around COVID-19, and boy, has it changed our everyday lives. Not only that, we've had to get used to lots of new words and phrases. Next slide, please. So a year ago, most of us had never heard of social distancing, never heard of Zoom, and we'd never heard that dreaded phrase of new normal. During lockdown, all those put off jobs suddenly jumped to the top of our lists. Anything that stood still was painted. As soon as a weed dared to show its head, it was weeded. And Sunday family quizzes and bingo became the norm. We had to teach a whole generation how to use video calling so we could all stay in touch, and the dustbins were going out more than we were. And next slide. Of course, there's a very serious side to COVID-19, but thankfully for us at BEHÇET'S Patient Support, we've been able to carry on supporting our patients without any of the financial worry of reducing working hours or furloughing our staff. That said, we've had to look at the way we operate to protect our staff and our patients. We took the decision very early on in the pandemic to stop attending clinics and switch to a remote model of supporting our patients, which has continued to work really well for us and hopefully for our patients. Next slide, please. The biggest impact for us at BEHÇET'S Patient Support has been the lack of face-to-face contact with our patients at the centres. So much of our work is based around these conversations and help us provide the right level of non-medical support for our patients. Quite often it's the informal chats in a waiting room that highlight potential support for our patients. Chatting and listening to patients is a key function of Jean, Jackie and Beck when they're in their clinics. Fortunately, the lack of physical face-to-face contact has not stopped us providing invaluable support to patients during these very difficult times. Our support coordinators are used to working remotely from the centres. Indeed, probably 80% of their work was already done away from the physical centres themselves. Next slide, please. That said, we still had to adapt to new ways of working with our colleagues in the NHS. Whilst not attending clinics, we still need to know which patients have been seen by centre staff, whether that be face-to-face or virtually by video or telephone. We've managed to stay in touch with our colleagues at the centres as we get to know who has been seen or contacted by the centre and who we can then contact ourselves to offer our support. Every patient who's attended a physical or virtual clinic has been contacted where we have their contact details, just in many cases to check in, make sure they're okay, and make them aware that we are still here to help with their non-medical support needs. We've had regular catch-up calls, meetings with the clinical psychologist to chat through patients that might need extra support to help them get through this pandemic. It became apparent very early on in the pandemic that the mental health was as important as their physical health. We worked closely with our colleagues at BEHÇET'S UK to make sure we had the most up-to-date and relevant information on our websites. In the very early stages of the pandemic, Jean, Jackie and Beck spent a lot of their time sourcing information about shielding, furlough, benefits, local authority support, and other important help and support so we could continue to signpost our patients. We ourselves are about to embrace technology too to help us stay in touch, whether that be by the formal systems in place at the centres, things like Attend Anywhere, or just providing text and telephone and video support to our patients. We've certainly got our heads around Zoom calls and Microsoft Teams calls. Next slide, please. Making sure we stay in touch with our known vulnerable patients has been very key for Jean, Jackie and Beck. Having a very stable team allows for great relationships to be built with our patients, and that knowledge helps us stay in touch and ensure that this key group of patients receive the support they need through the pandemic. Our support coordinators have dealt with online supermarket deliveries, sourcing local authority support, providing IT support to patients to make sure that they themselves can stay in touch with their own family and friends. One of the benefits for us being such a small team, we can work incredibly well together and can be flexible to adapt quickly to the changing needs of patients. Our flexible working patterns have allowed Jean, Jackie and Beck to adapt to the ever-changing rules and regulations and continue to provide a first-class service to our patients. So whilst lots has changed because of the pandemic, we are still here supporting our patients with their non-medical needs, whether that be employment needs, education needs, emotional needs, or economic needs, or just a chat. Next slide, please. Every quarter we produce a newsletter. We call it BPS Matters, which is shared with our colleagues at the centres. Producing the newsletter gives us the opportunity to look back at the previous 3 months and reflect on the support we provided to our patients, what the impact of that support has been, our successes and any trends that we are seeing with our patients. Those trends being whether positive or negative, so we can work as a team to make sure we continue to provide a first-class service. We've started to share a condensed version of the BPS Matters newsletter on the BEHÇET'S UK website. So please do log on a regular basis and see what we're up to and pick up on the hints and tips. We want to help you live well with BEHÇET'S. Next slide, please. Picking up on some of the trends we've seen, obviously there's been a very negative impact of the pandemic. We are all aware of the shielding issues at the very start of the pandemic and the pressures that we are seeing on the NHS resources, not just at the centres, but across the entire NHS. Next slide, please. But we've also seen some positive impact. We're getting more used to the different ways of communicating and working with our patients. We've adapted our working arrangements to meet the needs of our patients. We're reaching out to even more patients, and we're seeing an increased sense of community as a result of things like the Clap for Carers early on in the pandemic and the neighbourhood support that we've seen out in our communities. Next slide, please. Just a couple more things to mention before I close. Earlier this year, we launched the 2020 Quality of Life Survey. Over 400 people agreed to take part in the survey and provided data. That's been sent to the team in London for them to analyse, and the results of that survey will be shared with you all shortly. Hopefully, you've not been surveyed out. I'd like to make you aware of another survey we've launched with our colleagues at the London Centre of Excellence. The aim of this survey is to look back at how the past few months have impacted upon your life and your well-being, and to see what early lessons we can learn as a team to make sure we are prepared for the winter. The link to the survey is on the slide, and you can also access that through our website, behçetspatients.org.uk. It takes about 10 minutes, and the information will be analysed again by the team in London. In closing, I know that Rachel's already mentioned Bike for BEHÇET'S Run for the Rare, and we must not forget the very positive impact that fundraising challenge has had, not only on the team, but hopefully the wider BEHÇET'S community. Not only has it raised an enormous amount of money, but it's raised awareness and given the team a focus during these strange times. Even a small team of riders and runners should never underestimate what can be achieved by working as a team and supporting each other. A simple like of a post, a few words of encouragement, a few tips all go a long way to making the challenge a success. It doesn't matter how far you've run or cycled. The important thing is to be part of that team and to help each other achieve their goals. Can the same principle be applied to living well with BEHÇET'S? I believe so. Working in partnership, BEHÇET'S Patient Support, the NHS and BEHÇET'S UK, also known as Team BEHÇET'S, will continue to work together to support our patients. We all play our part in helping our patients live well with BEHÇET'S. Next slide. Thank you very much.
Brilliant, John. Thank you so much, and for all that you and everyone's doing, and Jan heading it up, and the trustees that are supporting. So that's fantastic.